Hello everyone, I am Dr. Ekta Bhushan, teaching Anatomy and Physiology of Exercise at Indira Gandhi Institute of Physical Education and Sports Sciences, University of Delhi. I welcome you all to online lectures of CEC-UGC. In this series, we will discuss different topics associated with sports medicine, but today in particular, we will discuss the topic sports injuries. So, the term sports injury refers to the kinds of injuries that most commonly occur during sports or exercise, but they are not limited to athletes. Factory workers get tennis elbow, painters get shoulder injuries, and gardeners develop tendinitis. Even though they may not participate in sports, ultimately, however, sports injuries refers to those that occurs in active individuals. This health topic focuses on the most common types of sports injuries, those that affect the musculoskeletal system. The musculoskeletal system is the network of muscles, tendons, ligaments, bones, and other tissues that provides the body with stability and enables movement. So, what is sports injuries? Exercise is important to good health, but people often get hurt when participating in sports or other physical activities. A sports injury involves damage to part of your body due to sports, exercise, or athletic activity. So, sports injuries are divided into broad categories: acute and chronic injuries. Acute injuries happen suddenly, such as when a person falls, receive a blow, or twist a joint, while chronic injuries usually results from overuse of one area of the body and develop gradually over time. Examples of the acute injury are sprain and dislocations, while some common chronic injuries are shin splint and stress fractures. So, treatment for a sports injury depends on the type of injuries, but minor ones can usually be treated at home by resting, icing, compressing, and elevating the injured part of the body. For more serious injuries, you will need to see a healthcare provider, and you may need to be set up for a course of physical therapy for a rehabilitation and fitted for a cast, splint, or brace. In some cases, you may need a surgery also. So, a rehabilitation program that includes exercise and other types of therapy is usually recommended before resuming the sports or activity that caused the injury. While adverse events do sometimes happen when playing sports or exercising, most physical activity is safe for almost everyone, and the health benefits far outweigh the risks. So, who gets sports injury? So, who are the most what are the most risk factors for the sports injury? Includes not using the correct exercise technique, overtraining either by the training too often or too frequently or too long, changing the intensity of physical activity too quickly, playing the same sports year around, or running or jumping on a hard surface, wearing shoes that do not have enough support, not wearing the proper equipment, having had a prior injury, having certain anatomical features specific to each joint or poor flexibility, taking certain medications such as fluoroquinolones, a class of antibiotic linked to tendinitis and tendon rupture. Now, the types of sports injuries. So, already I said that we have divided sports injuries into two parts. One is acute injuries, which happen suddenly. Another one is chronic injuries, which are usually related to overuse and develop gradually over time. So, types of musculoskeletal injuries. Now, injuries to the musculoskeletal system that are commonly in athletes, including fractures, dislocations, sprains, strain, tendinitis, or bursitis. These terms are defined below. Let's start with the skeleton injuries. So, in skeletal injuries, first category is a bone fracture. A fracture is a break in a bone that occurs from either a quick one-time injury known as an acute fracture or from repeated stress known as stress fracture. Growth plate fracture are unique to children who are still growing. So, acute fracture, stress fracture, growth plate fractures. Let's start with acute fractures. So, a fall, a car accident, or a blow can cause a fracture, and the severity depends on the force that caused the break. The bone may crack, break all the way through, or shattered. Injuries that break through the skin to the bone, which are known as compound fractures, are especially serious because there is an injury risk of infection. Most acute fractures are emergencies. Now, stress fracture. Stress fractures occurs largely in the weight-bearing bones of the lower extremity. These includes the femur, tibia, and fibula, and foot bones. They are common in sports where there is repetitive impact, primarily running or jumping sports such as gymnastics, tennis, basketball, or track and field. Running creates forces 2 to 3 times a person's body weight on the lower limbs. The next one is growth plate fracture. The growth plate fracture is an area of cartilage near the ends of the long bones, and they enable the bones to lengthen until children reach their full height. Growth plate fractures are especially vulnerable to injury until they are converted to bone, typically by the time a child reaches the age of 20. Growth plate fracture can result from a single traumatic event such as a fall or a car accident, or from a chronic stress and overuse. Now, we'll discuss the dislocation. So, joint becomes separated. We can see in the picture also there is a ball and socket joint, and humerus is dislocated from the shoulder scapula. So, when the two bones that comes together to form a joint become separated, the joint is described as dislocated. Contact sports such as football and basketball, as well as high impact sports and sports that involve significant stretching or falling, cause most dislocations. A dislocated joint typically requires immediate medical treatment, but sometimes the bone move back into place on their own. The dislocation is a painful injury and is most common in shoulder, elbow, fingers, kneecap, and femur tibia or knee. The next category is muscular category. In this, we'll discuss sprain, strain, tendinitis, and bursitis. So, let's start with sprain. So, sprain is basically an injury of ligaments. Whenever our ankle twist or any joint twist and ligament tear, we call it a sprain. So, sprains are stretches or tears of ligaments, the band of connective tissues that joins the end of one bone with the another. Sprains are caused by trauma such as a fall or a blow that knocks a joint out of position. Sprains can range from first degree, minimally stretched ligament, to the third degree, a complete tear. Area of the body most vulnerable to sprain are ankle, knee and wrists. Now strain. So strain is basically an injury of muscle. We can see in the picture, this is for first grade strain, second grade strain and the third grade strain when muscle tears. So a strain is a twist, pull or tear of a muscle or tendon, a cord of tissue connecting muscle to bone. Athletes who play contact sports can get strained, but they can also happen from repeating the same motion again and again, as in tennis or golf. Like sprain, strain can range from a minor stretch to a partial or a complete tear of a muscle or tendon. So this is most common in muscle or tendons between two joints. Now we will discuss the tendinitis. So this is the inflammation of tendon. The tendon is the medium which joint the muscle to the bone. So when inflammation happened in the tendon, we called it tendinitis. So tendinitis is inflammation of a tendon, a flexible band of fibrous tissue that connects muscle to bones. It often affects the shoulder, elbow, wrist, hip, knee or ankle. Tendinitis can be caused by a sudden injury, but it usually results from carrying out the same motion over and over time. People such as carpenters, gardeners, musicians and certain types of athletes such as golfers and tennis players have a higher risk of tendinitis. Tendons become less flexible as you age, so you are more likely to get tendinitis as you get older. Now, bursitis. So the inflammation of bursae is bursitis. So bursitis is inflammation of the bursae, that is plural to bursa, small fluid-filled sacs that act as cushions between a bone and other moving parts such as muscles, tendons or skin. Bursitis can be caused by a one-time event like a blow or a fall. It can also result from repeating the same motion many times, like throwing a ball, or from a prolonged pressure, such as from kneeling on a hard surface or leaning on an elbow. It usually affects the shoulders, elbows, hips or knees. Now we have come to the category of skin injuries. So skin injuries are cuts, laceration, gashes or tear. So these wounds that go through the skin to the fat tissues caused by a sharp object. Then scrapes, abrasion, scratches and floor burns. So these are surface wounds that don't go all the way through the skin. Scrapes are commonly on the knees, elbows and palms. Then bruises. These are bleeding into the skin from damaged blood vessels caused by a blunt object. They can occur with a cut or scraps also. Now we will discuss some common sports injuries. So most sports injuries involve one or more of the types of musculoskeletal injuries described above, and the joints are particularly susceptible because a person's body places significant demands on them. Joints must provide both stability and flexibility, and they are complex structures that includes several interconnected parts. Some of the common injuries experienced by the athletes and people who have jobs or hobbies that involves doing a repetitive motions includes. We'll start with the shoulder injuries, and in shoulder injuries we will start with the rotator cuff injury. We can see in the picture also, one is the normal shoulder and another one is the damaged shoulder. So these are the most common shoulder injuries. The rotator cuff is a group of 4 muscles and tendons that stabilize the shoulder joint. Rotator cuff injury happens when the tendons or bursae near the joint becomes inflamed from overuse or a sudden injury. They are common in people with jobs that involves overhead motions like painters or athletes who repeatedly reach upward, such as tennis players and swimmers. Then impingement. So impingement of the shoulder joint. We can see in the picture also the inflammation of the shoulder joint. So this happens when the top of the shoulder blade puts pressure on the soft tissues beneath it when the arm is lifted. So tendinitis and bursitis can develop, limiting movement and causing pain. Repeated overhead movements such as those used by swimmers increase the risk of impingement. The next one is instability. So we can see the shoulder joint and the normal shoulder joint and the inflammation of the shoulder. So the shoulder instability happens when the round end of the upper arm bone is forced out of its shallow socket, either partially or completely. Once the tendon, ligaments and muscles of the shoulder become stretched or torn, the shoulder becomes loose and dislocations can occur repeatedly. Then elbow injury. We'll go through with all the elbow injuries. The first elbow injury is tennis elbow, and it is a very common injuries. And we can see in the picture the normal elbow and the inflammation of elbow. So when you play tennis or other racket sports, the tendon in the elbow can develop small tears and becomes inflamed, causing pain on the outside of the elbow. Painters, plumber, carpenter and other who repeatedly using the forearm are also at higher risk of getting tennis elbow. Now golfer's elbow, you can see in the picture also, it happens in the medial epicondyle of the elbow. So this is a form of tendinitis that causes pain in the inner part of the elbow. Pain may spread to the forearm and the wrist. Golfers and others who repeatedly use their wrist or clench their finger can develop it. Now, little league elbow. You can see the little league elbow in the picture also. So this is a growth plate injury to the elbow caused by repetitive throwing in youths. It is most common in pitchers, but any young athlete who throws repeatedly can get it. The pain is in the inner part of the elbow. The next one is ulnar collateral ligament injury. So repeated throwing can cause tears to this ligament on the inner part of the elbow, causing the pain and decreased throwing effectiveness. Now we will discuss all the knee injuries. So this one is runner's knee, also called the jumper's knee or platformal pain syndrome. This condition causes pain or tenderness close to the under the kneecap, that is patella, at the front of the knee. It is common in runners, but it is also affects people who are active in other ways, such as those who bike or hike or cycles. Then fractures. Fractures can happen in any bone around the knee, but the kneecap or patella is the most common, usually as a result of an event like bad fall or a blow to the knee. Then dislocation. A large impact to the knee can cause the kneecap to the forced from the groove in the thigh bone and pushed out of alignment, causing the kneecap to the slip out of the position. Then torn ligament. When the knee is overextended or twisted, the ligament within it tear. Anterior cruciate ligament injuries are especially common in the athletes. They often happens when the person changes direction suddenly or lands from the jump. Then meniscal tear. Meniscal cartilage serves as a shock absorber in the knee. An awkward twist or a pivot can cause a tear. They are commonly torn when the knee suffers a sprain or a complete tear of the knee ligament. Then tendon tear. Tendon tear tend to be more common in the middle-aged people who play sports that involves running and jumping. They often happen because of a forceful landing and sometimes from an awkward jump. Then now we will discuss all the leg injuries. So the first one is growing pull. A quick side to side motion can strain the muscles of the inner thigh and lead to a growing pull. People who play sports such as hockey, soccer, football and baseball have a higher risk of growing pulls. Now hamstring strain. 3 muscles run along the back of the thigh and from the hamstring. Activities that involves a lot of running, jumping and sudden starts and stops place you a risk of a hamstring strain. Baseball, football and soccer players commonly get them. Then shin split. Shin splits refers to the pain caused by inflammation of a muscle, tendons and bone tissue along the inside lengths of the shin bone, that is tibia, the large bone in the front of the lower leg. The pain is usually on the inner side of the lower leg. Shin split are primarily seen in runners, particularly those just start a running program. Now we will discuss all the injuries of the ankle. We'll start with ankle sprain, which is the most common injury of sports. So you can sprain your ankle when you roll, twist or torn your ankle in an awkward way. Stretching or tearing the ligament in the joint. It can happen when you land awkwardly, when jumping or pivoting, when walking on an uneven surface, or when someone else lands on your foot. People who play sports in which there is a lot of pivoting, such as volleyball and basketball, are the risk of ankle sprain. Now, Achilles tendinitis, we can see in the picture also normal Achilles tendon and the inflamed Achilles tendon. Then symptoms of sports injuries. So now we'll discuss the symptoms of sports injuries. These are the symptoms: sudden or severe pain, extreme swelling or bruising, not being able to place weight on a leg, knee, ankle or foot, not being able to move a joint normally, extreme weakness of an injured limb, a bone or a joint that is visibly out of place, pain when you play or exercise, swelling and a dull ache when you rest. So now we have come to the conclusion. So participating in one or more sports is a vital part of a healthy, active lifestyle. Good for the heart, good for the respiration, good for building and maintaining muscle strength, etc. In a perfect world, only good would come of playing sports. But of course, this is not a perfect world. People move in a wrong ways, people trip and fall, people make sudden contact with the ground and with each other, and sports injuries commonly occur as a result. That said, the risk of injuries should obviously not deter you from the playing sports, but by being aware of some of the most common sports injuries, you can take the steps to prevent them or at least reduce the risk of getting hurt. So, I hope you understood the concept of sports injuries and all the common sports injuries. That's all for today. See you next time. Thank you.